All right, thanks very much. So Dallas County Judge Clay Jenkins finds himself in the unenviable position of trying to keep things calm and get things organized. How did you find out that we had a second case?
Dr. David Lakey, our public health commissioner, called me immediately upon finding out the PCR results, and then I immediately left for Presbyterian and met with their COO, and we worked through the night to prepare the necessary arrangements. I met with the family of this heroic health worker, mother and father, who are, obviously were in shock,
sure.
but handling it with grace, and promised them, they told me what they wanted, and we promised we would make that happen.
You have people who still live in this apartment complex. Now, the public areas, the hand railings, the doors, everything was disinfected immediately. I mean, it was quickly into action there. There are still people who live in that building. Are those people safe?
They are absolutely safe. Unless you've come into into contact with the bodily fluids of Eric Duncan while he was sick, you do not have Ebola, and you are not at risk of getting Ebola in this outbreak.
Now, there are a lot of other people, and this nurse was considered, because of the protective gear and the precautions that were taken, to be at low risk. There are a lot of other people on that low risk category. Should they be watched more closely? Should they be put in some kind of a special situation of quarantine?
They are being watched more closely. Immediately on hearing about the positive test, we moved them to active watch. I called in more CDC doctors who've already arrived. Every one of those healthcare workers is getting a twice daily check. The minute they get the slightest fever, they're placed into isolation. There's a protocol where they don't go through the regular channels to get to that isolation. We are working on that. We worked on it through the night, as well as working on arrangements for the dog through the night.
That's a thing a lot of people are very curious about, is what's going to happen to the dog. We heard what happened to the dog in Spain. It was euthanized for fear that it could be carrying Ebola.
This isn't Spain. It's important to her, and it's important to her mother, that this dog be taken care of. So if you're listening in your room, I want you to know we are going to take excellent care of your puppy.
Is there, at this point, after the early miscues at Presbyterian Hospital, and whoever ends up to blame, we'll move on from that, but are you confident that Presbyterian Hospital is capable of handling this second patient and perhaps more beyond that?
I am. We spent yesterday looking at those things. We're bringing in some of the most experienced Ebola doctors in America to work on that case here at Presbyterian. We're able to bring a lot of resources to Presbyterian because there's only one patient in the United States right now.
There was some material that was removed from Mr. Duncan's apartment, was incinerated according to guidelines, and now there's a fuss across state lines in Louisiana about whether or not they will take those incinerated ashes or not. Is that going to be cleared up?
Well, I hope so. This is an American problem. This is ground zero. It's a local-led response, but it's an American problem. We're stopping Ebola here in Dallas so it doesn't spread in other places, and we need everyone's help.
Okay, thanks very much, Judge. Lots more to do, and you just it's not much of a weekend for you.
A memorable weekend, but not one that I would wish on anybody.
Right. Thanks very much. We appreciate it.